Well, good evening and welcome to this meeting of the Healthier Communities and Older People Overview and Scrutiny panel. Item 1 is apologies for absence. Are there any apologies for absence?
Chair, we have apologies from Mr. Salim Sheikh, co-opted member.
Thank you. Any more? Right, item 2 is declarations of pecuniary interest. Are there any declarations? Okay. Item 3 is the minutes of the previous meeting. Are they agreed?
Yeah.
You can go like this if you're muted. Great, thank you. Now, what we're going to do is that we're going to deal with item 4 next, and then we're going on to item 7 with the agreement of the panel. Is that agreed?
Yeah.
Thank you. So, Dagmar, would you like to introduce your COVID-19 impact report, please?
Yeah, thank you, Chair, and good evening. So, as you are now aware, I will present to you again update of where we are with infections in Merton, and then I thought you would like a little bit of an update on the enhanced testing in Pollard's Hill. So I will go through the infection slides pretty quickly so that we have a little bit of time on the Operation Eagle, the enhanced testing in Pollard's Hill, for any questions. Is that okay?
That's fine, thank you.
So if Stella, you help me with the first slide. Okay, so if you move us on to the first, to the next one. That's it. So that's our summary messages, and I'm actually really relieved. I'm bringing good news. So infection rates in Merton, like anywhere in London and the country, are going down, and they continue to go down. Some really important values to draw attention to. The R value, the famous R value, is now under 1. That means the infection is shrinking. Now, it is important to recognize that we come down from very high cases. So we still hover around just under 300 per 100,000 per week. In the early days of the epidemic, we would have been horrified by that number. But now, because we're climbing down from a high of almost 1,000 per 100,000, that is really good progress. If we move us on. This is your London, what I call the tiles, and it shows you that the whole of London is now quite dramatically improving. You will remember me calling the colour a bruised colour when almost all of the London boroughs were purple. And you can see we have even got green shoots now coming up. Merton is in the middle of the pack. If you move us on. And this is a summary of our testing and the percentage test positives, all also going in the right direction. If you move us on. This is an important slide. It shows the COVID impact on the NHS. As you were very aware, there was a lot of pressure on the NHS. It is still very busy. You will see in the bottom left corner the bed occupancy, so there is no twiddling of thumbs. But as our NHS colleagues say, it feels a lot more manageable now. And on the right-hand side at the bottom, you can see that the severity of patients now is also luckily declining. If you move us on. So a few specific local analysis. This shows you all the Southwest London boroughs, and you see from a quite distinct peaking, we're all descending quite similarly in rate. If you move us on. These are our outbreaks, and as you can see from the last time I reported, in fact, it was just the last week, not the last time I reported, our outbreaks now are coming down as well. And we're obviously particularly relieved and delighted that outbreaks in care homes are coming down. And we hope and assume that that is a mixture of obviously infections coming down, very good infection prevention and control, but hopefully also the vaccination, because good news is that our care home residents are all vaccinated now. If we move on. This is the sad slide. You can see quite clearly the second wave in all its sort of ugliness. Luckily, we look to have peaked in terms of deaths as well. So the number 43 that is still in your slide set, I've just got the most up-to-date number today from last week, and it has gone down to 28. So I am confident now that we're on the descending side of the slope. That is also the experience from the NHS. If you move us on. This shows you, we're obviously in Merton particularly interested as well in the disparity of COVID, and we were monitoring very clearly what happens to the East and West. And we do it by age group to really understand how best to target and support. And you will see from a much higher level in the East coming down and the West now coming down. And I show you some other slides to illustrate that. If you move us on. This shows you again comparison between East and West. Sometimes it is easier to see the red columns are the East and the blue columns are the West, and you can see quite starkly the difference going through all age groups. And on the right-hand side, we wanted to ensure that we always check that we have enough testing for where the infections are. So there is more testing happening in the East and the West. If you move us on. And this for me is the slide that I'm monitoring very closely. So you can see when just before the lockdown, there was a real divergence between the East and the West, and I shared with you some of the hypotheses which are on the right-hand side, most likely due to occupational exposure and overcrowded housing. But as we are coming down, the divergence is luckily narrowing again. If you move us on. And similar pattern with the ethnic disparity. So between white and the rest of ethnic groups, there was quite an apparent disparity at the beginning of the lockdown, but that divergence seems to close down. It's on the ethnicity data. The last reporting is always to be taken with a little bit of a pinch of salt. The data are preliminary, but it seems to the proportion of white people versus ethnic minorities seem to balance out again. If you move us on. I won't dwell on those. I think for a reference, it is hopefully quite interesting to give you a little bit of feel what is the testing behavior, where do people in Merton get their test. And as you can see in lockdown, home testing is obviously a sensible and easy way to get a test, and because turnaround times are now much better, that is very much welcome. And we've also got the offer of the local testing unit, one in Merton College and one at Elms Nursery in Mitcham. If you move us on. And here you can see we had really a lot of testing activity when our infections were very high. Indeed, around the Christmas period, we had to ask for increased capacity, longer opening hours, but we are now way within capacity. So if ever you come across anybody who needs a test, who has even mild symptoms, do send them. There are now no shortages, and turnaround times have really very well recovered. If you move us on. And that is the last slide. It is a bit of a pathetic slide, but I thought I put in the first attempt to start to bring you some information around vaccination. As you probably will be aware, we're still working very closely with our NHS partners to get much more granular data that we can share with you regularly. At the moment, there are still a few hiccups, but we're on the way. So this is a very sort of simple slide, but the one message is that amongst the different sub-regions in London, or ICSs as they are called, integrated care systems, Southwest London on the whole is performing best in terms of vaccination uptake. Now, it doesn't let us completely off the hook. Of course, we need to know who and particularly also understand who hasn't had the vaccine in order to tackle any barriers. So hopefully in the future, I will be able to bring you more granular data. I think that's the lot on the epidemiology. So, Chair, shall I straight go into the Pollard's Hill enhanced testing, and then we scoop up all the questions together?
Yes, please, Dagmar.
All right. So, Estella, I'm relying on your help. Okay, so as you will be aware, because there was quite a lot of publicity, we have an enhanced testing program in Pollard's Hill, and we're one of 3 London boroughs at the moment, with Havering and Ealing, who have been asked by the national program to set up this endeavour. We actually got a phone call on a Sunday. I got a phone call on the Sunday, and we mobilised pretty quickly. So very briefly, to understand what is this about, why are we doing it? It is to track the South African variant, and it is particularly to track a South African variant to find out whether the South African variant is circulating in the community with no links to South Africa. So all over the country, over 100 South African variant cases have been identified, but most of them can be tracked back to South Africa. So then the worry that it has sort of escaped into community spread is not there. But unfortunately, in Pollard's Hill, we had a case, one case, and a while ago, that was found to have the variant with no links to South Africa. And it is very important to remember that the case has recovered, all the contact tracing has happened. So this is not like an acute outbreak of the South African variant. There was really quite a bit of misunderstanding. The purpose is that the national program wants to understand better, and so has asked us to do a 2-week testing program where we offer people in Pollard's Hill, as the geographic vicinity of our single case, the offer of an asymptomatic PCR test to basically track and understand the behavior of the variants better. And obviously the purpose of better understanding is that we can contain and control. And you will have heard there's quite a lot of interest in the variants. It is normal for a virus to mutate, and we have not to forget that the UK is very well endowed with the capability for genomic frequencing, so that we can measure it. Other countries simply can't measure it. And what we're focusing on is to find variants that are potentially either more transmissible or do more harm in terms of severe illness, or potentially can escape immunity. And variants with those features are called variants of concern, and those the national programme tracks very closely. So what we are doing in Pollard's Hill, everybody who lives in Pollard's Hill, works in Pollard's Hill, has essential activities in Pollard's Hill, is offered an asymptomatic PCR test within 2 weeks. And it's quite important. It is obviously, in a way, a bit of an arbitrary boundary. It is in the geographic vicinity of the case, around about sort of 10,000 people. And so we're not sticklers around the borders. So anybody around the borders, anybody worried, we can give them a test and offer them a test. So the next slide, Stella, shows you how it all works. So there are 3 options, because obviously we want to make it as easy as possible for people to test. These people are asymptomatic. The test is not nice. And then obviously you need, the intervention is you need to self-isolate if you're positive, and so does your household contacts and any close contact. So we are asking people, so we want to make it as easy as possible. There's a mobile unit. Now that's the picture on the left-hand side. And to be honest, I was a bit disappointed, because I thought, really, where are the wheels type of thing? But the white thing is the mobile unit. They use sort of fancy canopies. Then really what works well is the New Horizons Centre testing site, so common site trust, staffed with volunteers. You can pick up a testing kit, you can drop your testing kit, and really importantly, people can help you and explain. So it is a self-testing. The helpers and volunteers can't do the test for you, but they can explain, and they can also, really importantly, talk you through and link you up with the support that we have available for self-isolation. And then we've also got the third is door knockers, and that's quite important now with the weather being so horrible, that people come, knock at the door, hand out the test kit, again can answer questions, and then the test kit can either be dropped at the common site centre or picked up. And again, important that our Merton volunteers are recognisable, and that we're protecting against any scammers. So we've taken precautions there. And then the last one, I think it's the last one. So a little bit of progress, and it is I'm still getting new data in as we speak. So I can say the community has been amazing. And so have been the volunteers to stand this up very quickly and respond very, very constructively and positively. So all in all, we've now about 5,000 kits out in the community. The aim, in a way, is 10,000, but it is not so much the exact number, but the big message is we need to get the kits back. And important that the intervention, in a way, is if we find any positives, the same thing like now will happen. They will be informed immediately. They need to self-isolate, and contact tracers will get in contact so that the contacts also self-isolate. And that's the intervention, regardless of, in the end, it will be the South African variant or not. That's quite important to understand. There are not new lockdown rules. It's the same old lockdown rules, but we have to do them well. The genomic testing results, because all the tests go to a more fancy laboratory, it will only come out 10 to 14 days later. And as I said, in a way, that is not so much of interest for the containing. The containing is happening when you get a positive result. So if all of you wouldn't mind, if you have any contacts, get the message out there, please test. And if in doubt, get a test. So if you're on the border, and 3 options how you get it. Lots of friendly people around, and it is not, there is no acute outbreak of the South African variant, national lockdown restrictions apply as anywhere else. And on the website, all the updates and updated on a daily basis. So just to give you a bit of an overview of our enhanced testing program. Thank you.
Thank you, Dagmar. If I could ask a question to begin with, when the announcement about CR4 was made, there was a great deal of confusion because the media were reporting it as CR4, but it turned out to be part of CR4, and that wasn't made clear. And a number of people in the community were alarmed by that. Do you have any idea how that mistake was made?
Well, not exactly how the mistake was made, but the way the reporting happened said there is a case that the cases normally get labeled by the beginning of a postcode, so CR4, and then the locality is asked to describe a community of about 10,000 people. And CR4 has 45,000 people. So it was up to us to think what is a meaningful geographical vicinity within which to do the enhanced testing. So we had to go back and tell them, call it CR4 with a focus on Pollard's Hill. And the better news outlets then on their map, because we are not the only one, said, please note it is often not the whole postcode because it's more often than 10,000 people.
Thank you.
But it was problematic, I agree, it was very unhelpful.
Are there any other questions from members? David. You're muted, David.
Yeah, right. Just to clarify the matter of CR4 in relation to Long Thornton ward, the ward is actually divided a bit in half. The road going down, the main road, Roan Road, cuts the ward in two halves. One side is CR4 and the other side is SW. And this matter has actually created confusion all along because people living on one side are not actually identified as Pollard's Hill. I mean, it's Long Thornton. But they are Long Thornton, it's just that their postal code is SW. I hope that, they would actually make this clear in the future, because it presents itself as a difficulty every time we have to deal with these kinds of matters. Right? Yeah, it's a simple issue. Yeah.
I think it's a good point. It's a very good point, Councillor Chung, and we've raised it up because we're one of the first in London, as I said, one of 3, and so we are gathering all the feedback and the learning. And one of the very loud feedback that you're confirming is that how you describe your geography so that it makes sense needs a little bit more thought. And what we are therefore saying now is, if there are people in the vicinity on the borders of Pollard's Hill, we are not stickling what is the postcode. We say if we offer you basically a test. Yeah, so that's why the message, when I put in the slide, the key messages, if in doubt, you get a test. Now, what we are clearly saying is it is a local initiative. So we're not inviting somebody from Wimbledon to turn up in Pollard's Hill, but around the borders of Pollard's Hill, rather have a test than not have a test. That's the message.
Are there any other questions from members? Okay, well, in that case, Dagmar, can I thank you for your report, which is clear and helpful, and can I once again thank you and your colleagues for the work that you are doing in dealing with the pandemic. And no doubt you come into lots of contact with our colleagues from health, and when you do see them, if you can pass on our thanks to all of them for the work that they are doing, we'd be very grateful. And
many thanks, Chair.
I know you've been doing long hours, so if you want to disappear having presented your report, please feel free to do so.
Thank you very much. Bye-bye.
Thank you. Right, so I indicated at the beginning of the meeting, with the consent of the meeting, that we would now move on to agenda item 7, which is on the supplementary agenda. And I'd like to ask Caroline Holland to introduce that, her report, and answer any questions that members may have.
Thank you, Chair. So when I came to your last meeting, I said that I would be back, to paraphrase Arnie, with the third round for scrutiny, with an update to the business plan, which we took to the 18th of January, some further savings, some further draft equality assessments, and an update on the settlement. So the good news for this panel is there are no additional savings coming forward for you to review. There are savings, though, for other panels, and we're sort of meeting again tomorrow night and at the Commission on next Wednesday. The settlement was actually in some ways better than we thought it.
Sorry, Caroline, you froze there for a moment or two. Could you just repeat that? I heard the settlement was somewhat, and then it froze.
Sorry,
just a good bit.
Yes, better than we thought it would be. So we got some additional funding, but unfortunately it's one-off, so it doesn't necessarily help us plan for the longer term. And we did have confirmation that we are able to do an adult social care precept of up to 3%, and we can phase that over 2 years. But we did get caught out previously with a limit on the amount of precepts you could do at any one time. So we are recommending that we will do the 3% for 1 year. It also confirmed the council tax referendum limit of 2%. So we will be recommending a council tax increase of 1.99%. And that would be before the GLA precept has come forward as well. Clearly, with the issues that TfL are having, they have been given additional dispensation to have a further £15 precept to cover the cost of the concessionary travel. So additional costs and also linked to the under 18 travel will be picked up by TfL and by London boroughs. So just to draw that attention to you as well. We had within the update, then we have used some balances to get to a balanced position, some of our reserves, and we have set out in the report, para 6.2, which ones they are, and I'll just get the page number for you. So that was on page 29, and then we've shown how the gap changed from December when I last came to you to the January. And you can see within that there was a COVID and a local council tax support scheme grant. And within our December paper, our council tax base has actually reduced because of the increase in people claiming our council tax support scheme. So that's the first time since 2013 we've actually had an increase in the number of people claiming. The number of working age people had been reducing, and we are anticipating a further increase when furlough ends in April, unless that is extended again. There is a national budget coming on the 3rd of March. We are not expecting too much change for local government at that stage, but it may have further impact on either businesses or our residents with regards to unemployment or the furlough scheme. So we remain to see what happens there and therefore what knock-on impact that has for us. There was also some new homes bonus and other grants have been confirmed. Some are less than what we thought, but then there are some new grants that have come forward. In particular, adult social care grants have continued. There is a further social care grant, which can be used for both across children's and adults. And we're just waiting to hear still confirmation of what our public health grant will be. So that's, we think it's quite interesting, the fact with everything going on that we still have not had confirmation of the level of that very important grant to be able to support Dagmar and the work that she is doing. So happy to leave it there, Chair, and answer questions on this paper. And then I didn't know if you wanted to refer to the previous savings or the recommendation you want to make back to the Commission for next Wednesday. Thank you.
Thank you. So are there any questions at this stage for the Director? David.
Yes, thank you, Chair. I know that you don't have any details about the grants, the actual figures in relation to the grants, but the general question I wanted to raise is this going to be significant in relation to impacting on the amount of money that we'll actually be having to forego because of the lack of grant facilities?
So we have set out in the report information on certain grants that we have received. So we have had sort of business rate grants, revenue support grants, and some adult social care support grants have been confirmed. So where they have been confirmed, we have built those in. But as I said, some are one-offs and some will continue. So that's where we've tried to maximise their use to protect some of the services that we are delivering. And that's set out in Appendix 1 of the report in front of you tonight.
Are there any other questions for Caroline? Okay, so Caroline, you referred to our sort of previous meeting. Are there issues that you would want to draw our attention to in respect of that?
I suppose it's just to draw your attention to the fact that there were savings put forward, and just if there's anything formally you are referring back to the Commission next Wednesday, but nothing in particular that I would like to draw your attention to. Just if there were comments that people had on the equality assessments or the service plan, happy to take those forward as well. So because clearly they are draft and will be amended as we go through the process until those proposals will be implemented.
Okay, are there any comments on the equalities assessment or the service plan? Any questions? No? Okay. Are there any comments that people would like to make in terms of what we refer on to the Scrutiny Commission? I mean, we did have quite a long and detailed discussion last time, so perhaps that's kind of insufficient.
Yeah.
Okay, well, in that case, Caroline, can I thank you for providing us with that update, and I think that means that you can reach the end of your working day at 10 to 8.
Yeah, thank you for your authority to let me leave. Thank you.
Welcome, but thank you for your report, and so we'll move on now to item back to the main agenda, and that is item 5, the Merton Safeguarding Adults Annual Report. John, would you like to present this, please?
Yes, thank you, Chair. So I'm here tonight to give Scrutiny panel members an overview of the Merton Safeguarding Adults Board Annual Report for the year 2019-20, which is included in your pack, and it starts on page 17. The report summarises safeguarding activity undertaken in that period by the Council and its key partners and the performance data figures to date. I just wanted to clarify that I'm presenting the report for the year 2019-20 as the annual safeguarding report is published retrospectively and reflects on the work undertaken for the previous period. This is due to the process in which the Department of Health and Social Care collate the national annual data returns. I'll start off with just very quickly a little bit about what the board is. So the Merton Safeguarding Board, or the SAB as it's abbreviated to, SAB. The SAB is a statutory function under the Care Act, and the board is responsible for writing and publishing the annual report. The board has an independent chair, and ours is Aileen Buckton, MBE. Aileen took over from Teresa Bell in 2020. Again, if you go to your pack on page 17, you will see the foreword from Teresa as the actions took place during her final year in post, where she mentions the improvement in safeguarding practice in Merton. From next year, our new independent chair will be presenting the annual report to you, because it will be her report. I'm presenting this year because it's from the previous chair and she's now left, of course. So the board holds a strategic function across Merton and is made up of key partners from statutory and non-statutory partners. This report is an important function as it provides an update on the multi-agency work undertaken to raise awareness of safeguarding and highlights areas to take action and safeguard vulnerable adults in Merton. Another important function is to show the work of safeguarding vulnerable adults in Merton at a strategic level, as safeguarding is everyone's business, and for safeguarding to work, it needs to be embedded across all partner agencies, not just the council. As you will see, I'm pleased to report that the data shows for safeguarding a significant improvement in our data across all areas of safeguarding from previous years. Last year, when I presented the report for the year 2018-19, I updated members on the work ongoing to improve the recording of safeguarding on Merton's database to ensure all episodes and resulting work undertaken with regards to safeguarding was captured, and that the literacy of our staff with regards to safeguarding across the system improved. I'll just take you through some of the very practical things that we've done to result in such a dramatic improvement in our data. So we simplified the safeguarding process and recording on the Merton client database. This has made the whole safeguarding process, the recording of the process, much simpler for our staff to use our database and record things correctly, resulting in us being able to gather the correct data. We've also simplified the safeguarding forms that need to be completed, making them more user-friendly and less complicated for staff to use, and also simplified the safeguarding pathways within the teams. We set up a quality assurance process, which includes an auditing tool for a manager to audit individual safeguarding cases to ensure consistency and quality of practice. Along with this, we've set up monthly meetings with all managers, looking at safeguarding data and taking action to address any issues as they arise. In summary, we're focusing not just on the data, but on the quality of safeguarding work in Merton. We've also recommissioned safeguarding training in all levels for our staff and managers, and all staff have been retrained in safeguarding. We've also recommissioned mental capacity training, and we have rolled this out across all of the teams to ensure mental capacity literacy. You will see from the report, because this report is not just for Merton, this is the entire system within Merton, that our other partners have been embarking on similar work to improve safeguarding in Merton. And if you go to page 23 of your pack, you will see how the board works through its 4 subgroups, which drives improvements across the system in Merton. I won't take you through each of the subgroups in detail, as they are all mentioned in the report, and I'm sure you've read it, but they focus on safeguarding adult reviews, or SARS, which I'll discuss later in my report, how the system learns and improves, performance, and then communication and engagement. These subgroups are key to making improvements in safeguarding across the system, as the subgroups are made up of key staff from across all of the partner agencies, and they drive the changes within their own organizations, and then the board monitors this work. I'll now go on to the data itself. So if you would go to page 36 of your pack and look at the first graph at the start, the top of the page, I'll take you through the safeguarding data for Merton. So the very first line in the graph shows the huge amount of work we've been doing over the last 3 years to improve the data for safeguarding in Merton. During 2019-20, Merton Local Authority received 732 safeguarding concerns in total. This is significantly higher than the number of reported concerns raised in 2018-19, which was 483, and 322 in 2017-18. I think it's really important to say this does not show that we are having more safeguarding in Merton, but the work that we've done that I detailed earlier is showing that we are capturing the correct data on our database, and then we're able to give the correct data to the Department of Health. The numbers of referrals for 2019-20 are now in line with safeguarding numbers across London and are in line with what we could expect to see. So for our statistical neighbours, these are the sort of figures, 732, that we should be receiving. The data also shows a significant improvement in the numbers of Section 42 inquiries, and that's on line 2 of the first graph. In Section 42 inquiries are the statutory safeguarding inquiries led by the borough, led by the social work teams that are undertaken following a referral. The overall conversion rate from a referral to a Section 42 inquiry increased from 20% in 2018-19 to 50% in 2019-20. This is just above the national average and is a positive improvement for Merton safeguarding processes. It's important to explain that not all referrals, so not all of the 700, etc., referrals turn into inquiries. Some of them follow different pathways from care management assessments, alternative actions, or in some cases, no further action because this referral was inappropriate. The other area I wanted to highlight was our work on safeguarding adult reviews. I'll abbreviate it to SAR, S-A-R. And if you go to page 35 of the report, you will see the update on SARs. You will see from the paper that a SAR is a legal duty, again, undertaken under the Care Act 2014. And SARs occur when there is a death or an incident that shows extensive multi-agency working and is evident that the system could have worked together differently to prevent a death or an incident. It isn't every date that happens with every death. It has to meet a certain criteria. And it generally is that the system could have worked differently to prevent that death or that incident. The purpose of a SAR is to learn from cases on a multi-agency level to prevent similar incidents occurring. The aim of a SAR is not to apportion blame on an organisation or individual for any failings that may have been discovered. The SAR process is one of the subgroups of the board, and the SAR evaluation, which is co-chaired by myself and a representative from the police, where we evaluate all the referrals to look at the criteria to see if it meets the threshold and make recommendations to the independent chair on referrals. So for the year in question, 2019-20, the board did not receive any SAR referrals during that period, but there were 4 reviews which have been ongoing and continued throughout 2019. These 4 reviews commenced in 2017-18 and have been delayed due to unforeseen circumstances, due to COVID, due to finding an appropriate independent reviewer, etc. However, 2 of them are in the final stages of completion and will soon be published. In 2021, we have so far considered 2 referrals for safeguarding adult reviews. And that was all I wanted to update on that page. The next area I wanted to update from the annual report was page 32, and the Learning Disability Mortality Reviews, or LEADER as it's abbreviated to. The LEADER program was established in 2015 to help reduce early deaths and health inequalities for people with a learning disability by supporting local areas in England to review deaths of people with a learning disability and to ensure that any learning from these reviews led to improved health and care services. This was introduced by NHS England. LEADER is led by the CCG, but with full involvement from the learning disability team and all of its partners. The review and evidence is helping to make improvement in services for people with learning disability and autism, by change in practice, including improvement to multi-agency working. From our data in 2019-20, you will see a reduction in deaths from the previous year. LEADER nationally has led to the introduction of health passports so that an LD person have the paperwork with them when they go to the hospital, so hospitals are clear on those individual needs. Also, the teams focus on annual health reviews by GPs to ensure that each person in a learning disability health is reviewed by the GP in conjunction with the learning disability team annually. Nationally and locally, more work is needed on this, and in Merton we will prioritise annual health checks and passports for people with an LD over the next few years to embed this practice across the teams and across the system in health. Just before I finish, I've taken you through the improvements in Merton, but everything isn't perfect. And if you go to page 38 of your pack, you will see the agreed priorities that we'd agreed as a board for the year 2021. I'm not going to take you through these because you'll have read them and you might have some questions, but I wanted to just update that the service needs to be flexible and change priorities as it moves along, because COVID-19 has had an impact on our residents, on our vulnerable residents, and new priorities have come to the fore, and we need to monitor and adapt our practice and priorities as needed. An example of how things have changed since the start of COVID, and this isn't just in Merton, this is across London and across England, is an increase in incidents of domestic violence during the pandemic. We have a well-established multi-agency forum called MARAC in Merton. That stands for Multi-Agency Risk Assessment Conference, which is led and chaired by the police with members from all partner agencies, including health, the council, housing, statutory voluntary sector housing associations. It is all of the system coming together to discuss these complex cases. This meeting for high-risk domestic violence cases to be discussed and information shared and agree how to proceed with these complex situations. The forum is seeing a higher number of referrals during the pandemic, and a meeting that used to be half a day per month is now 1 day per month to deal with the increased referrals. Safeguarding is an area that Hannah and myself can never take our eyes off of. The complexity of the work are compounded by the complexity of each individual situation and each individual referral. People's lives are complex, and that results in often complex and challenging situations with families, with friends, with neighbours that we have to deal with. So Hannah and me can never take our eyes off of safeguarding. We've got to keep an eye on it all the time. But the board is key to us working together as a system to improve the outcomes for vulnerable residents across Merton. There's nothing else I wanted to highlight from the report, but I'd be very happy now to answer any questions you may have.
Thank you, John. Linda, do you have a question?
I do. Can I just say on page 32, John, that there's a discrepancy in the totals there. If you look at page where it says total notifications, and you've got 11 for April 19, and then you've got 18. If you look at the bottom column where I think those figures are coming from, you've got 18 in the June 2017, but you've only got 9 in there. So somebody's missed a couple of stats out. It's just, I just point it out, but
No,
it's not a major issue, but it is a discrepancy.
No, it is a major issue, and thank you for clarifying it. This comes from the CCG, and I'll take it back. The report isn't published yet because it goes to the Health and Wellbeing Board.
Oh, then it can be corrected.
Yeah. So we've got plenty of time to change it. So thank you, Linda, for noticing that.
Okay. I'm a designated safeguard lead for the community centre, but I'm also an ex-special needs coordinator. And one of the things that bothers me a little bit about scrutiny function is that this is a report that we can do absolutely nothing about. I'm much more interested in what we can do about what's happening at the moment. So for me, priorities for 2021 are the issues that I want to be focused on. And, you know, we should be asking questions about what are the staffings like, what's the workload you're dealing during a COVID crisis. For me, it's you know, a done and dusted thing. Well done on the data improvement. I mean, no argument with that, but, you know, we really need to be focused on what's happening now, I think.
It's a good suggestion, and we could look at it when we're planning for the next scrutiny topics.
Thank you.
Are there any other questions from members? Nigel.
Okay. Thank you, Chair. It's a good report, and I want to say well done. However, there's very little comment have been made on the housing. You know, people who abuse or either abusive people. Is it possible? Can you please explain further why it's not mentioned in the report? Thank you.
Could you clarify again, Nigel, what it is you want? Which people not reaching? What was the point?
Sorry? Oh, I see. Just talking about the housing people, and it is very mentioned in the report as part of, you know, safeguarding people, and when people are abused or people who are abusive, there must be powers to take them away and put them in a separate safe home.
Well, you know, that's a good question, actually, Nigel. And that the final paragraph I spoke about was the complexity of working with adults.
Yeah.
Because adults, if they have capacity, and if they have capacity to make decisions, they're able to make good decisions, bad decisions, and often unwise decisions. So the complexity of safeguarding within adults is that we have to work with that person to see what it is they want. Mm-hmm. So what outcome is it that they want? And often they might be living just say with a daughter or a family member, and there might be some abuse. But that person might say to us, look, yes, I feel safe, but I'm getting some verbal abuse. But the worst option for me would be not to see my family, not to see my grandchildren, and to be removed from my family home. And all I want is someone that I can contact and call if I need some help. So we might say, oh, but we could get you a nice little sheltered house and we could move you out and make sure, but that's not what they want. So the goal of safeguarding is to work with the adult and get the outcome that they want. And I didn't actually touch on it, but in the report, it is one of the things that we actually do well. And that's called making safeguarding personal. Making it matter to that individual is something in Merton that we've historically been doing well, and I aim to maintain. Does that answer your question, Nigel?
Yes, yes, yes. Thank you.
Thank you, John.
But I can, of course, say if someone doesn't have capacity, we would look at a best interest decision to see what was in their best interest. So under the Mental Capacity Act, we are able to gather a group of professionals, key family members, and make a best interest decision on their behalf. And at times, that could mean that we would look at alternative accommodation.
Yeah.
Thank you, John.
Thank you.
Do any other members have questions? David?
Yeah, I think I pick up on thank you, Chair. I want to pick up briefly on the point that Linda was making. In your opening remarks, we referred to the independent chair's comments. I quote, 2020 has, of course, seen unprecedented demands on local services as a result of COVID-19. Now, we still have COVID-19 with us. And I mean, I know in one of the reports, it seems things are improving and the situation is actually peaked and hopefully coming down. The question I wanted to get from you, John, the question I wanted to raise with you, John, is and thanks to all the detailed systems that you have in place to try and address all the issues. But given the demands that COVID has placed on us, do you think that the service and the systems in relation to staffing, etc., is good enough to cope with these demands?
Well, that's another good question, David. That is a good question. It is unprecedented times because so much of our focus has been on preventing hospital admission, discharging, vaccines, testings, and everything else. But since April, the system as a whole for protecting vulnerable adults has continued. At no point has the borough stopped its safeguarding activities, and key partners have also done the same. All of us actually have put in extra resources. And the example I used about the MARAC process, that multi-agency process for people that are victims of domestic violence, that meeting's now doubled in length and more people are attending it. We've put some more resources into our safeguarding team. But how long is a piece of string? We are planning, we know that at the end of this, there's an increase in people with mental health issues. You've already seen that I've told you about an increase in domestic violence. In this financial year, when I take the report in January next year, you'll see an increase in safeguarding in residential and nursing homes, as we would expect to see during a pandemic when so much was focused on residential and nursing. So I think that we are going to have to put some more resources in as a team and a system. I think that we've already started thinking about it as a system, but again, how long is a piece of string? How long is the pandemic going to go on for?
Anyone got the answer to John's question?
Dagmar, where's Dagmar?
Oh, she's gone, I'm afraid. She's but are there any other questions to John? Okay, one that I had, and I think Linda was kind of touching on it in paragraph 1. You talk about we're only publishing the data for 18-19, and I think there's a sense in which, you know, why is it that we can't have more up to date? You said that the Department of Health has to analyse the data. If we were delaying getting data to them for a year, I've no doubt they'd be cutting grants and threatening us with all sorts of sanctions.
No, I can't explain it. I can't explain it. So it's
Good.
actually 2019-20 that I'm presenting. So it's the previous financial year. So we have to submit our data after March. And it takes us a month, 6 weeks, 2 months to get all of our data together and then send it to the Department of Health. They publish the data, so every local authority in England, there's probably 120, 140, all send their data in, and then it's published at the same time. And it's generally published between November and about now. This year, it was published, last year it was published slightly earlier. That's why I'm taking the report in February. Last year, I think I took the report in March. So we have to wait to get that published, confirmed data before we can publish our safeguarding annual report. Then, of course, we have to come to scrutiny. We have to go to the Health and Wellbeing Board. So generally, it's published in March. Does that answer your question?
Well, would it not be possible to provide us with data earlier with the caveat that it was subject to the approval and finalisation from the Department of Health? Because if there were issues that were emerging, then by the time we get to look at them, you know, it's potentially too late.
Sorry, Hannah.
I was just going to come in, Chair, because I think one of the critical things that we can't miss, safeguarding isn't just a local authority, it's a partnership. So we're actually quite reliant. The data we're presenting is not just our data. And of course, that leads you into a whole load of other questions, because we're actually reliant on data from across the system to get the full picture. So what I can reassure you is that the teams are continuously monitoring the local authority data, because we own it. And of course, we can share it with you because it's ours. And we monitor monthly the number of referrals, the themes, and the sources of referrals. That's only one small part of the data set. The bigger part of the data set is what happens across the London Ambulance Service, the local NHS, including the local hospitals, but also the local GPs. And then, of course, we've got our mental health trust as well, and our police data. So what we always kind of are behind, and the reason we're behind is the difference in each system's data collection date. But certainly from a local authority perspective, if you requested, Chair, that mid-year we brought you an up-to-date position on local authority data, which might feed nicely into Linda's point about discussions about what we should be focusing on in terms of our work programme, we certainly can do that. But what we won't be able to do is we won't have that data ratified, and we can't give you the whole partnership data, but we can certainly give you the local authority data if you would find that helpful.
Linda?
Yeah, I think when you said half yearly, I was thinking, well, half yearly, we're halfway through a year and it's all over almost. Sorry, I think quarterly, if we're going to do it. Definitely not half yearly.
Yeah.
Yeah, we need to feel that we know what's going on.
Yeah.
Otherwise, we really can't scrutinise anything. Thank you.
I absolutely agree. And what I would say to you, Councillor Kirby, we'll certainly take that back to the independent chair. The one thing I want to reassure you also is that the board's role and the independent chair's role is to make sure that data is scrutinised at every meeting. So it is scrutinised within the board, and I don't see any reason why we can't bring an updated position on where we are with safeguarding, especially in light of the pandemic, because there's a bit of recovery. We could see a spike in referrals. We could see a spike in referrals from care homes. We could see a spike in referrals from families where adults are struggling because of their position coming out of the pandemic. So quite happy to produce that on a quarterly basis and give you an oversight, up-to-date position on where we think we are in terms of the referral sources and some of the themes. We can also produce some of that, if that would be helpful.
Well, I think my view would be, Hannah, that if it's not going to create problems in terms of resources, then I think it would be helpful. And what we could do is do it for a period and review it in the light of experience. So perhaps that's the way forward. So you're telling me that you're quite happy to undertake all this extra work and get more reports to us, despite all the difficulties you're facing at present.
What I would say to you, Chair, is, as we all know, safeguarding, as Linda pointed out to us earlier on, is everybody's business. It's every one of it is a day job. It is a constant job. It's not something we do once a week. We have this information at hand. We know our referral sources. We know the themes that's coming through. Our teams are on top of this. So to provide that for you, I wouldn't see as an additional workload. What I would see it as an additional assurance for you as a scrutiny panel to be assured that our safeguarding board is effective and our independent chair is holding us to account as partners across the system to keep our vulnerable adults safe.
Thank you. Can I ask whether there's been any noticeable changes since the police reorganisation in terms of BCUs and whether that's had any impact on their input into this important process?
So I'll take that one, Chair. I would want to reassure the panel that we work incredibly closely with our police colleagues, and of course they're a statutory partner. So irrespective of their restructures, and we know organisations, you know, we've seen a whole different changing landscape in the NHS, for example. But the NHS, the police and ourselves are the statutory partners that has a statutory duty to ensure safeguarding. Then we've got quite a lot of informal partners to support us in that role. The police sit on our board, their attendance is absolutely excellent. And in any cases where we are really concerned about complexity of vulnerability, they work incredibly closely as part of what John described you, that multi-agency coming together to ensure the safety of that individual, but also ensuring that the individual has a say in this. As John said, it has to be about working with that individual, not doing things to that individual as a multi-agency approach. So very, very supportive and carry out their statutory function without any concern from the local authority or from the independent chair, actually, as well, Chair. Thank you.
Well, I'm pleased to hear that because we do get the BCU commander coming to the Standards and General Purposes Committee from time to time, and if there were issues, then there'd be an opportunity to raise them there. But it seems as though things are working extremely well, so pleased to hear that. Who appoints the independent chair?
All three chairs. So with our safeguarding BCU lead, who is Inspector Owain Richards, and the managing director of the CCJ.
Sorry, you're breaking up, Hannah. John, do you want to answer that? You might have a better connection.
Hannah interviewed with the previous chief executive of Merton CCG and Owain Richards, the chief constable. So there was a tendering process and then the interview process from the three statutory partners of the board.
Okay, thank you. Are there any other questions from members? Okay, well, in that case, can I...
Chair, can you clarify for me, Chair, if we made a decision about getting the data?
Yes, we have agreed quarterly presentations of the meeting. I'm sorry if that wasn't clear, but having been reassured that that will not place an excessive burden on our staff and that the data is available, and taking into account the needs expressed by this panel, then we've agreed that we'll receive it quarterly and review it after a period of time to see whether that is a satisfactory arrangement.
Thank you.
Okay. Any other questions? Okay, well, I was thanking you, John, for your presentation and for answering our questions. Item 6 is the work programme. Can we note the work programme? Okay, well, in that case, having noted the work programme, having gone through our agenda, I would like to thank you all for your virtual attendance and your contributions. And I can't even wish you a safe journey home, but I hope you remain and keep safe. Thank you very much. Good night.